Hello, my geniuses. Welcome to another anatomy lecture series today. It's your great science tutor Lorenzo. Today we'll be talking about a new topic, which is muscles around the arm. So we have talked about muscles around the pectoral region, around the shoulder region. Now we are talking about the muscles at the arm. So we want to talk about that. So we want to talk about it. So make sure you start from the pectoral region, the shoulder region. It leads you to the muscles of the arm. And also watch my videos on the bones of the upper limb, because it's very, very important. You have to start from bones, muscle attached from bones to bones. That's why they are called tendons. So you check the bones first. When you hear the bones, I'll give you a specific part whereby it will be coming out in your exams and for you to understand. And always use your atlas. Always use your atlas. So if you are just joining us, make sure I tell you, press that subscribe button now and turn on your post notification button, so anytime I drop a video, you'll be sure to be notified. Now let us jump right into the video. So welcome guys to another video. We'll be talking about the muscles of the arm. So we can also call arm the brachium. I can also say the muscles of the brachium. So brachium is the arm, while antebrachium is the forearm. So when you remember brachium and antebrachium, you know that it's arm and forearm. So we want to talk about the muscles of the arm now. So how do you know the arm? So check yourself. How do you know the arm? The arm is that part of your humerus. So when you're touching your humerus now, so touch your humerus. When you touch your humerus, just after your shoulder joint, that vertical bone is called your humerus. I've treated it in my last video when I talked about the humerus bone. So go and watch it now before you come here, so that it will be much more easy for you. So that is your brachium, your humerus part. So now it is very important now, because it separates the shoulder joint and the elbow joint. So it is joining the elbow joint and the shoulder joint. That's humerus bone, which you call the arm. You get it now? So since we know it's our arm now, it plays an essential role in movement of the upper limb. Very, very important too. It plays an essential role in movement of the upper limb, in lifting, pushing, pulling, throwing, and fine motor coordination. So that's what it does. So it helps you to lift something up. It helps you to push something. It helps you to pull something. It helps you to throw something, and it helps you to work for fine motor coordination. Now the muscles of the arm are primarily concerned with the movement of the elbow and shoulder joint. So because of they are crossing the shoulder joint, and they are also crossing the elbow joint, which means they have function in the shoulder joint and the elbow joint. So one thing you have to remember, any muscle that crosses a joint will give a function to that joint. So that's one thing you have to understand. So when we say it originated from here and inserting here, which means they are crossing the joint, going and coming. So since they are originating and inserting, crossing the joint, you have a function in that joint. That is what the arm muscles are doing. They are also crossing the shoulder joint and crossing the elbow joint. Very, very important. Now they are arranged in the anterior and posterior compartment. Anterior and posterior compartment. So the anterior compartment, you can call it the flexure compartment, while the posterior compartment, you can call it the extensor compartment. Very, very easy. Now these compartments now are divided by the intermuscular septum. Intermuscular septa or septum. So singular is septum, plural is septa. Very, very. So they are divided by that. These muscles act through powerful lever, and their proper function is vital for our daily activity, and also use it for clinical assessment. So they act as a lever which performs special function, which is used for your activity of daily living, and also use it in your clinical assessment. So this muscle is very important. So you remember, very simple. So you remember with this mnemonic at BBC. At BBC. So what is at BBC? At is for the posterior compartment, BBC is for the anterior compartment. So you remember BBC News. BBC News, when you say at BBC, I am at BBC. At BBC. At is anconeus and tricep. Anconeus and triceps. But anconeus, you should also remember. So anconeus can be regarded as a muscle of the forearm, posterior compartment of the forearm. The anconeus can, so some textbook can put anconeus under posterior compartment of the arm or posterior compartment of the forearm. So for today, let us put it under posterior compartment of the arm. So the anconeus and the triceps, while the front is the BBC, which is bicep brachii, brachialis, and coracobrachialis. Bicep brachii, brachialis, and coracobrachialis. So with the characteristics of the anterior compartment, because we'll be starting with the anterior compartment. So what is one characteristics of all of them? Very simple, because in this video I'll be putting both of them. I'll be putting audio muscle ones together. I will not separate them. You get it? But if the video is long, I can cut it into two parts, so as for you to so that it will not be so long for you and for you to understand them. So let us see if the video is much more longer. When I do everything, I'll cut them into two. So now, what is the characteristics of the anterior compartment, which we call the flexure muscle? Now, first of all, they are all innervated by musculocutaneous nerve. Musculocutaneous nerve. So what's musculocutaneous? It innervates muscles and later it innervates muscles and later it innervates skin. So musculocutaneous nerve, C5 to C7. Why? Because this branch is coming from the what? Lateral cord. This branch is coming from the lateral cord. So go watch my video on the brachial plexus. So what is their function? Their function is to flex the elbow and also supinate the forearm. So they flex the elbow and supinate the forearm, and also they also act on the shoulder joint too. So that's one thing you have to know. So they can flex the arm at the shoulder joint and flex the forearm at the elbow joint. So they can flex the forearm at the elbow joint and flex the arm at the shoulder joint. So also they help in supinating the forearm. They help in supinating the forearm. And don't forget the muscle BBC. So let's pick the first B. So who is the first B? The bicep brachii. From the name, you remember bicep, two things. Bicep, that is two hand, two head. That is two head, brachia. So bicep brachii, two head. So its origin is two head now. You have the long head, you have the short head. So the long head is coming from the supraglenoid or tubercle. The supraglenoid tubercle. Put it in your head. Long head, supraglenoid or tubercle. While short head is coming from the tip of the coracoid process. The tip of the coracoid process. So you have the long head and you have the short head. The long head is supraglenoid, while short head is the coracoid process. Tip of the coracoid process. So if you look at the scapula, the scapula, if you look at the scapula, where do you have the glenoid cavity? The glenoid cavity is where the head of the humerus enter. On top of the glenoid cavity, you will see a supraglenoid tubercle. So now, where is the insertion now? So this now it forms a belly. So it goes down and forms a belly. And once it forms a belly, it forms this. Now, when you put your hand, you flex your hand and you show as if you are doing see my power. Maybe for all those muscle builders that used to show people their power, that part, that their big bicep muscle, so that part you are seeing it on the screen now. So that is the bicep muscle. It forms that belly. So when it crosses the humerus, it forms that belly, and once it forms that belly, now it inserts on the radial tuberosity. So when it's inserting on the radial tuberosity, what does it do? It crosses the it crosses with the biceps aponeurosis, because a muscle cannot just cross a joint like that. It needs an aponeurosis to assist in crossing. But in this one now, it needs a bicep aponeurosis, which is the deep fascia of the forearm. Don't forget, which is the deep fascia of the forearm. So since we know it's inserting on the radial tuberosity to the bicipital aponeurosis. So what is the nerve? So musculocutaneous nerve. What action does it give? Bicep. So bicep is flexing the forearm at the elbow. Goody. It's flexing the forearm at the elbow. It is supinating. So it's an assistant supinator. So it supinates the forearm, but it just assists in supination, because the chief muscles that does supination is the supinator. So it's just assisting in supination. I get it. And it also, since it crosses the shoulder joint, it will flex the arm at the shoulder joint. So it does two functions: flex the forearm at the elbow and flex the arm at the shoulder joint, and it supinates the forearm. Very, very easy. And it's very, very important for what we call bicep tendon reflex. For bicep tendon reflex, which is C5 to C6. So by putting your hand, so you go watch my video on deep tendon reflex. This is a neurological testing to check for reflex activity. You get it now? So very, very easy. So the next one, BBC, B, which is brachialis. And so where is brachialis coming from? Brachialis is coming from the lower anterior surface of the humerus. Lower anterior surface of the humerus, because the one covering all the whole muscle is the bicep. So in the bicep now, you have the one coming from the lower side. The one coming from the lower side of the humerus is called the brachialis. So brachialis is not crossing the shoulder joint. Brachialis is just coming from the lower part of the humerus. So when it's coming from the lower, but in the anterior surface, so when it's coming from there, it originates from there and inserts on the coronoid process of the ulnar tuberosity. So it's inserting on the coronoid process of the ulnar, and also inserting on the ulnar tuberosity. So it's also inserting on the coronoid process and also inserting on the ulnar tuberosity. Don't forget. So the brachialis is inserting on the ulna, while the bicep brachii is inserting on the radius. Very, very easy. Don't forget it. So this one now is the chief flexure of the forearm at the elbow joint. So it's the chief flexure of the forearm at the elbow joint. So when you are flexing your forearm, going and coming. Now take for instance, you are taking a dumbbell and you are what? Are flexing the dumbbell. For those going to the gym. So when you are flexing the dumbbell, that is what we call flexure of the forearm at the elbow joint. And it is the chief flexure of the forearm at the elbow joint. While the assistant is what? The bicep. The assistant, the bicep. So the bicep helps you to flex. So when you are trying to call the dumbbell, when you are calling it, like the one you are seeing in the video. So when you are trying to call the dumbbell, so you are using your brachialis and you are straightening your brachialis and your bicep. The next one is the coracobrachialis. The coracobrachialis is deep to the bicep brachii. It's deep to the bicep brachii. I told you that the brachialis do not cross the shoulder joint, so it's only act on the what? Elbow joint. But the coracobrachialis is originating from the tip of the coracoid process. So where the short hand or where the short arm of the what bicep brachii is originating from, that is the same way the coracobrachialis is originating. So remember, coracobrachialis, coracoid process inserting on the brachium. Coracoid process. So where in the coracoid process? Coming from the tip of the coracoid process. So where is it inserting? It is inserting on the what? Medial aspect of the humeral chaff. The medial aspect of the humeral what? Chaff. So it's inserting on that medial side, close to the what? Deltoid what? Tubercle. Close to the deltoid tubercle. So it's inserting on the medial aspect of the humeral chaff. While the brachialis is coming from the what? Lower end, the anterior surface of the lower end of the what? Humerus. Don't forget it. The action is that it flex the what? Arm at the shoulder joint. It flex the arm at the shoulder joint. And it does what? Weak abduction. It does what? Weak abduction. So when you remember all these things, it's quite easier for you to understand the origin, insertion, and action of the muscles of the anterior compartment of the what? Arm. Very important. So we are done with the muscles of the anterior compartment of the what? Arm. We'll be moving next to the muscles of the posterior compartment of the arm. Don't forget. So I'll see you to the next video. So go watch the next video on the posterior compartment of the arm.